This is Jennifer Creekmer, Improvement Advisor at Iowa Healthcare Collaborative. This recording is on the Hospital Engagement Network, or HEN, measurement, readmissions, and care coordination. This measure has one outcome, 4 process, one of which is required, 8 MB-QIP ED transfer communication, which are optional, 0 denominator is not allowed for the self-reported process measures. Our data sources, 1 comes from IPOP and 9 come from self-reported. When we look into the toolkit, it does start with description and rationale, and then it has a definition for each measure. Our outcome measure, unplanned all-cause 30-day readmissions. The numerator includes the number of acute care inpatient discharges that meet criteria for all-cause 30-day all-payer readmission. This includes admissions to other facilities. So when we look at this, you have to remember that sometimes you will not see this number from other facilities for a few months. So you can look at your own readmissions and know that the numbers may be different depending on how long it takes other hospitals to put in their admissions. This does come from IPOP data, and you can call IHA and find out patient-specific information on this if you have questions. Looking at our process measures, we have 4 to choose from. The first one is patient teachback, number of observations of nurses where teachback is used to assess understanding. When you look at this, this can be sampled, and this can be on different things. This could be on medication, to make sure they understand their medications, to make sure they understand their discharge, to make sure that they understand their diagnoses. So this could be for many things. The next one, community involvement in identifying post-discharge needs. This is the number of acute care, skilled nursing facility, and swing bed inpatient discharges where community providers were included in assessing post-discharge needs. So this also can be sampled. These are all self-reported process measures that you can sample any way that you choose to do that. When we talk about sampling, we want to make sure that we hit the community or the area that will impact your hospital and make it better. The next measure, post-hospital follow-up appointment, number of acute care, skilled care nursing, and swing bed inpatient discharges with follow-up appointments scheduled before discharge in accordance with risk assessments. So when you look at risk assessment, it depends on what tool that you use. We do have in our resources the LACE tool, but I'm unsure what every hospital uses for their tool. Those all should indicate how many days the patient should be seen. So when we look at what the measure says, it says that the inpatient discharges with follow-up appointment before discharge in accordance with the risk assessment. So what's really important on this is somebody is in a situation where the doctor has not written for a discharge planning follow-up appointments, that we make sure that the nurses are following up with the doctor and asking them when they would like to be seen, and that that doctor is also documenting the reason that he is just going to let them follow up as needed, or he wants to see them in 14 days. And then obviously if they're high risk, they're going to be seen in 3 to 5 days. The last one, number of acute care, skilled nursing facility, and swing bed inpatient discharges where critical information is transmitted to the next site of care. Again, this is self-reported, and you can sample this. And then the last one to choose from is the ED transfer communication. This is for MB-QIP. You will see that we did put the timelines down because the deadlines are different for the MB-QIP than they are for the HEN information. When we look at the ED transfer communication measures, we are basically being a repository for Telegen. So you can put your information in here, and then we get it to Mary Beth Sorensen. If you have questions on these measures, please contact Mary Beth Sorensen. At the end, we do have suggested resources for this measure. We have HRAT, the top 10 checklist for readmissions. This is a great checklist just to look through and say, are we doing the things that we should do? And when you are doing those things, I think that's a time to show that to your staff and show that to your board to make sure that they know that you're doing what you should be doing. Also, when we look through these, we have the LACE tool. And then we have teach-back information. We have information from IHI, ARC, and many other resources. If you have any questions on the readmission measure, please contact myself or Jennifer Brockman, and we will be happy to help you.